Good morning, ladies and gentlemen. I am Dr. Manoj Sharma, Head of Department of Spine and Orthopedics, Jaipur Golden Hospital, Rohini, Delhi. Today, I am going to speak about how to treat your back pain. The most of the back pains, almost about 90% of them, can be treated with minor medicines or physiotherapy and massage and resting. Very simple things. And it is only about 10% of patients where the back pain is very resistant and it goes on and it becomes chronic that we need to worry. So, the most common cause of the back pain is the minor strain and sprain of the back and stress in the back, which settles down generally with rest and the medicines for pain and inflammation within a week, generally within 3 or 4 days, or maybe at the most a week or 10 days. But if it doesn't settle down, number one. Number two, if it travels from the back down to the leg and we start having numbness in the leg, or we start having difficulty in urination, or we find it that our urine passage is numb, then it is a matter of concern. And the second most common cause of the back pain is slip disc. Our spine has got 33 bones, like we have got 7 bones in the neck, 12 bones behind our chest, 5 bones in the lumbar spine or behind our stomach or tummy. And then we've got the pelvis where we have a sacrum where 5 bones are fused. So between each 2 bones, we have got a rubber type structure called disc. And because the most mobile part of our spine is either the neck, we keep on moving our neck all the time, or it is the lower back when we bend it. Because in the chest we've got the ribs, so chest spine is fixed. Similarly, the sacrum, the last part of the spine, is also fixed because it is a part of the pelvis. So the most common places where these discs can slip out is either the cervical spine or the neck, or it is the lumbar spine. Now, what happens when we have a slip disc? The slip disc, like in the back, if we bend in front, the disc is pressed from the front side, and like when you press a balloon from front, it will pop out or it will bulge from back. So exactly the same thing happens in the disc, that when we bend in front, it will bulge from the back and it can come out like this. You see this red thing has been shown that the disc has popped out. And at each level, there is a nerve coming out. So it will start pressing the nerve. And because these nerves from the lower back go to our leg, we will start having problem in the leg. We will have pain going down the leg, or numbness, or weakness, or some tingling sensation, or some different kind of sensation, which we call paresthesia. So, and if you've got a slip disc in the neck, here the nerves go into our arm. So we will have pain in the neck going down the arms. We can have some numbness in the hand, some tingling sensation, or maybe some weakness in the hand or weakness in the grip. So this is the feature of the cervical slip disc. And for the lumbar, we will have pain going down the leg. Now, how to treat this? It has been said, as in these cases also, most of the time, if we take the medicine and the physiotherapy where we take some traction and exercises, then most of the time, about 90% patient will be fine. But if they do not get fine, or when they start becoming worse, then we have to go for an MRI and we have to see, and the patient may require a surgery. Now, so far we were doing an open surgery or a microsurgery where we were using a microscope to do it, but now we are doing the latest endoscopic surgery. Endoscope is just as thick as this, and we go from the side. We don't have to go from the back, and we do not cut any structure, and we can go straight away to the disc and we can remove it. And the beauty is that this procedure is done under the local anesthesia. The patient keeps watching it on the TV. We show him that, look, this is the disc, this is the nerve, and this disc is pressing the nerve. Now in front of him, we will remove the disc, and he will feel the relief of pain right on the operation table. So that's the beauty. And And we are the pioneer in that. We purchased the first endoscope of the country in 2000, and we have done more than 4,000 cases of endoscopic disc. And endoscopes are also of many types. So now we do a latest one which is called as transforaminal lumbar endoscopy. And this is a foramina. Now, I don't want to speak that scientific word here, but this is a technique where we don't remove any structure and we can just remove the disc and the patient is happy. So, ladies and gentlemen, I wish that you have a strong back and you don't have any back pain or leg pain. But in case you have a slip disc, you approach us. I am Dr. Manoj Sharma at Jaipur Golden Hospital, Rohini, Delhi. And we are the pioneers and masters in the minimally invasive and endoscopic spine surgery. Have a nice day. Bye-bye.